in general, cancers in Black people tend to be more prevalent than in whites. They started at an earlier age. Breast cancer, ladies in their 30s and early 40s tend to have breast cancer in Blacks, as opposed to white people, where it's later on in their 50s and so on. It's more aggressive. They tend to spread more quickly. They tend to relapse too. Once they've had the treatment, it tends to come back. Sometimes it's even more difficult to treat. And I think one reason for that, number six, so one reason for that is that most of the research that has been done in oncology and cancer treatment has been more on whites than on Blacks, for obvious reasons. There are more white people in the population. The whites are in the ruling class by far. Nothing, no, nothing to, I'm not trying to disparage anybody, but that's just a fact. What we know is that the Black biochemistry, the Black physiology is quite different from the white physiology. So we have to do more studies on Black people so we can understand how the Black physiology or the Black body responds to certain conditions. These slides will be available on our website, brainandbodyfoundation.org. And also we're creating like a resource base, a resource center for people like you to go to and to take advantage of. So if you want to take advantage of that too, please go to our website as well. Here are some of the really bad ones. African Americans have the highest death rate and shortest survival of any racial and ethnic group. Oops, this thing is not really showing very well, so I'm going to try and move things a bit. All right. African Americans have the highest death rates and shortest survival of any ethnic and racial group in the US for most cancers. That's not good. Now, should I talk? Well, let's not talk about prostate cancer yet. But here's the thing: I need to say something. We are the kings and queens of prostate cancer for men and breast cancer for women by far, and the statistics show it. Not just in the U.S., but everywhere where you have Black men and Black women. It's a significant population of Black men and Black women living in a predominantly white country. So in the UK, maybe in France, Australia, South Africa. Well, there are more Black people in South Africa, but anyway, there's a significant white population. Everywhere you put those two side by side, Black people, Black men, Black women tend to have higher rates of breast cancer and prostate cancer than their white counterparts. They also have a higher death rates as well. So you can see Black men have a 40% higher cancer death rate than white men. African American women have a 20% higher death rates than white women. And we could keep going on and on and on. Breast cancer is the most commonly diagnosed cancer in Black women, followed by lung cancer. And again, the good news just keeps on coming, all right? I put this picture of Creflo Dollar here because he's a prominent Black minister. He had breast cancer, excuse me, he had prostate cancer at an early age, before the age of 40. So did Ben Carson, whom many of you know. I actually wanted to be a neurosurgeon at one time, so he was my idol growing up. Now, politics aside, I'm not here about politics. I'm just here to talk about cancer, and these are great examples. So let's talk specifically about breast cancer in Black women. I've already mentioned it is the most commonly diagnosed cancer among Black women. It is also the second most common cause of death in African American women. I think that the first one is cardiovascular disease or heart attacks. It is diagnosed earlier. It is more aggressive. It is harder to treat. And I'll probably mention a few things about that as we go on. I've mentioned it over and over again that Black women tend to die at a higher rate. They die at an earlier age, and there's a greater chance of relapse. One of the things that I learned when I was treating cancer patients and I was studying in Nigeria was one of my boss there was saying, one of the things he tries to tell Black women or the people who he treats for breast cancer is that they should not get pregnant, because in his experience, that cancer tends to come back once the woman gets pregnant. It doesn't happen among white women, but Black women, he has seen a greater tendency for that cancer to come back. something about hormones, something about another child growing, maybe the growth spurts, the need to feed. I don't know. He hasn't been able. He wasn't able to tell me exactly why, but that's a factor.